Hypoparathyroidism, or hypoPT, is a rare condition that occurs when the body does not produce enough parathyroid hormone, PTH, or the levels of PTH in the blood are too low to be detected. Hypoparathyroidism, or hypoPT, can cause a variety of symptoms, some of which are short-term and others that are long-term or even severe. Short-term symptoms may include muscle cramps or spasms, stomach pain, irregular heart rhythm, tingling in the extremities, confusion, dry hair and skin, easily broken nails, weakened enamel on teeth in children, painful menstrual periods, and anxiety or fear. These symptoms can be mild and may resemble those of other conditions, so it's important to keep track of when and how they occur to help your doctor diagnose hypoPT. Long-term complications of hypoPT can include cataracts, calcium deposits in the brain, kidney pain, depression, and a poor quality of life and health. These symptoms may indicate chronic hypoPT and can be difficult to detect on your own, so it's crucial to see your doctor for proper evaluation and management. Severe complications of hypoPT may include seizures, kidney stones, and larynx spasms that can cause breathing problems. If you experience any of these severe symptoms, it's important to contact your doctor or local emergency room immediately. In children with hypoPT, there may be issues with physical growth, tooth and dental problems, and slower mental development. Some of these complications may be irreversible and require lifelong care. Similarly, in adults with chronic hypoPT, there can be other irreversible complications that need to be addressed by a healthcare professional. It's important to discuss all of the symptoms and experiences with your doctor to ensure the proper diagnosis and management of hypoPT. The parathyroid glands are small, typically the size of a grain of rice, and there are 4 of them. They are usually located behind the thyroid, but in rare cases, they may be found in the chest or esophagus. The parathyroid glands are responsible for regulating the amount of calcium in your body. When there is too much calcium in your blood, it's called hypercalcemia. But when there is too little, as is the case with hypoparathyroidism, it's known as hypocalcemia. Calcium plays a critical role in your bones and blood, as well as in the functioning of your nerves, muscles, blood clotting, and heart. Therefore, a deficiency of calcium, or hypocalcemia, can disrupt these important bodily functions. Hypoparathyroidism, or hypoPT, can be caused by genetic factors or events later in life, like surgery or autoimmune disorders. Surgery, especially neck or thyroid surgery, is a common cause of hypoPT in adults, but it can also be genetic or related to autoimmune disorders like Addison's disease or pernicious anemia. In rare cases, low magnesium levels in the blood can also lead to hypoPT, but the good news is that this condition can go away once the magnesium levels are back to normal. Hypoparathyroidism, also known as hypoPT, can be either temporary or permanent, but the good news is that it is treatable. If you ever feel like something isn't right in your body, it's important to see a doctor. It's important to note that hypoPT is not very common, and some of the symptoms you may be experiencing could be attributed to a different temporary condition. It's essential to pay attention to your body and any changes happening inside and outside of it. Always make sure to ask your doctor to check for this illness if you suspect that you may have it.